Good. I haven't been live for almost a couple days. Just been trying to recover from my little injury. I hope you guys are doing good. I just finished my dinner. Oh, I end up hurting my shoulder. Still hurts quite a bit, and my head a bit. Delivery my baby in July, going through anxiety. Delivered my baby in July, going through anxiety. Why are you going through anxiety? What's going on? How come? Is the baby keeping you awake? That's the whole idea. That's the whole beauty about it. Take some L-theanine. Hope you're okay. I am feeling better actually. Starting today, my shoulder kind of a little bit. Usually this happens every couple years with my shoulder. End up injuring the shoulder, and I'm out for like almost a week. I can't even do my own shoes or nothing. It was tough. Not even responding to my emails because my arm will constantly get numb. I had that too when a baby was born. Lasted the 3 months. Anxiety. It is tough. It's not easy. It's not easy. Hey Yuru, how are you? Hey guys, let's tap the screen. We can get more likes. It's not about the likes. It's about getting more people to join us, so we can talk about. We can talk about what activates or what activates heart disease. You look like David Huggins? Really? People are probably watching Trump versus Camilla. Camilla is a joke. That's what I think. I know I'm in Canada, but still. Low carb snack. I hope this is actually. I just had my last bite of dinner, so usually if I want to have a snack, I would have this right away. This is actually raw organic walnut. I get them from one of my neighbors. He gives me a small bag every year. That's the only time I would eat them. These are actually picked from his tree, and he gives me a small bag every year. So this is what I get every single year from him. They're grown locally here, and they're really good actually. That's the only time I would actually eat walnut. Reverse aging in 4 simple steps. Sleep. Be thankful. What else? What else? Stress-free. And drink some good spring water. I think that's the most important thing. I am now over walnuts. Yeah, this is it. They look really good. They taste really nice actually. They're very, very smooth, very creamy. It's funny when you actually get them locally from somebody who's been growing them, and you actually taste them without being sprayed with anything. They actually taste really, really creamy. Really nice. This guy is a warrior. Cheers. Thank you. Are you in Canada? I am in Canada, yes. I love how Camilla and Obama rhyme. 2 of the greatest people of all times. This is a joke, right? And guess who eats walnut with me all the time? Every time I'm cracking some up. Duke. But I have the door closed on him. He's outside barking. I love on those are the best. Cheers. Have you heard about edema occurring in patients due to side effects of the insulin? Yes. Oxalate issue? Yeah, they're very high in oxalates. Oxalates and phytic acid as well too, but keep in mind, I don't eat these daily. Like this is only gonna be once a year my treat. Keep in mind, a lot of the stuff that I actually eat would be whatever is available per season, and if I'm actually able to get it locally. Like these are actually from a friend of mine. He has actually a walnut tree, and he gives me a bag every single year. That's it, a small bag, roughly about 2 pounds. That's the only time I would eat actually walnut. And same with any other fruits, like even if blueberries. This year I only ate 1 cup of blueberries. That's it. So every year with difference. Last year, one of my good neighbor gave me almost about a box of cherries. So it depends. If I get any, I will eat it. If I don't get any, I don't go out and buy it from a store. Calgary is raining a lot of water. We need some water here. My creek is drying up. Now every time I fill up drinking water, it takes me almost like 30 minutes to fill one liter. It's like a dripping. And Duke is outside barking like crazy. We'll go give him a little visit. Just joined. What do you eat? I'm just having some walnuts, some raw walnut. This is just after my dinner. That's the only time I would actually have it. Is there anything you eat consistently daily? I eat meat daily. I haven't stopped for 10 years. 2 pounds a day. Yesterday I did a 24-hour, 23-hour fasting. I only had 1 pound. When I do fasting, I don't really eat no more than about a pound. So tomorrow maybe we'll do another 24-hour fasting. I don't know. We'll see how it goes. Any Bigfoot sightings? I wish. Haven't seen any yet. But Duke is barking at something. Favorite meat? Yak. The meat I eat is yak meat. Something about cortisol. What about cortisol? Let's go see what's Duke barking at. Gotta brighten the screen a bit. There's Duke. Hey. Hey. What are you barking at? Is there a coyote there? Is that a coyote? What are you barking at? What do you see? Show me. He's too busy barking. When you fast, if you're worried about cortisol, Ziggy, you can actually take L-theanine. What are you chewing, Duke? Come here. Duke, come here. Let's brighten up the screen, guys. Give me a sec. There we go. Hey. His face is so dark. Slugs are 12-16% protein and plenty of minerals. Slugs, you kidding me? These slugs are disgusting. Trust me, I have lots of them here. They come out at night. They're anywhere between like 2 to 5 inches in size. So this is what we did in the past couple of days. I kind of fixed the top section for the deck so I can actually put my 2x6 rafters and close the section up. So I went from the ground up, and check it out. We cleared this section there, and I got somebody to come with an excavator and clear it up so I can turn it around with my truck. So we've got a little bit more room. And the deck was shaky, so it's not shaky anymore. It's pretty sturdy, which is nice. And it's dark already. It's been cloudy all day. Hey, Duke. You wanna go in there, have some walnuts? Hey. Would a Bigfoot be a carnivore or a herbivore? Like a gorilla? If a herbivore, they would have to eat their own shit like gorillas. Yeah, no kidding, eh? That's interesting. I think they are probably herbivore more than anything. I don't think they're carnivore. Would be nice to actually view one. I don't know if I can look. You can. I don't know if I'd like to walk in this crown lands behind me. It's so freaking dark in there. Trust me, when I'm out at 2-3 o'clock in the morning, it's pitch dark. You can't even see anything. You have a rich source of protein, calories, and minerals there with your slug colony, 90% per 100 gram. I don't think slugs are edible, Blaine. Are you gonna kill me? You're gonna give me like some kind of parasites? You know the nice thing about the slugs? They clear everything. Even if Duke poops and I don't actually pick them up, if I actually come the next day, almost 80% of his poop is gone. Because that's all the slugs do. You'll have like 5, 6, 7 slugs on his poop. It's kind of crazy. Do you eat bread? Any kind of bread? I haven't had bread for like 10 years. Hi, good night, love, from Trinidad. Leaving so soon, Sharon? Have a good night. Hey, Monopoly, how are you? Look, I'm going inside to finish my walnut because I don't like to stop and snack again. I just like to have a 15-minute window to eat, and that's it. And that's it. Uh, let's finish my walnut, guys. What time is it there? It's getting dark already. It's only like 7:30. For the past couple of days, because of my shoulder been hurting, like really bad, and I haven't been sleeping that good. I've been waking up every day about 2, 3 o'clock in the morning. So I've been trying to sleep early by 8 p.m. Um, just so my shoulder feels better. 3 hours behind. Go do acupuncture. Closest place for acupuncture is 4 hours drive. Ziggy. Hi Maurice, it's been a while. Hey, how are you, Joyful? Yeah, no kidding. 9:31 CST. So you're about 2 hours ahead of me. Purge the waste from your slugs before cooking them. They can carry nasty parasites. That's what I heard. And they ate already half of my cucumbers, so I actually had to spray everything the other day in my greenhouse to get rid of them. Detroit, 3 hours behind. So what is it? About 4 o'clock your time? That's pretty early still. I'm trying to move these lives earlier and earlier for you guys. Any Roman wolf packs? None. I haven't seen any yet. I know closer to winter time, I think we'll start to get. What happened is, so keep in mind, guys, whenever right now, because the season is still a little bit warm, all the animals will actually go up higher elevation because they want cooler weather. So the colder we get, the more animals we start to see in here. So probably before I leave in December to go see the family, I'll probably come across maybe a few animals. Yesterday about 3:30 in the morning, we had 2 coyotes come, and they sit there and bark for like at least a good half hour. So what happened is I let Duke out, and seriously, within about 2 minutes, Duke being outside and he actually howls at them, they already left. They left the scene. They get scared from him, which is nice. So which is I really like that. Where are you going in December? I'll be heading back to the city again in December because I'm gonna be spending the December with the family. So I won't be able to come back here because I think the roads won't be as safe. So I'll come back here off a grid. Let's say December, January, February, probably in March again, or February, April. Yeah, April or March, I think. What is it with? Hello, what's the best food to prevent dementia in your opinion? Just reduce any processed seed oils and sugars. What is May and September that I always get major digestive issues? Usually September is a cooling phase for detoxification of the liver. I don't know about May. So maybe that's what comes in September for you. That's the time frame for the liver to actually detoxify. I'll be heading to Calgary in Canada. Duke could easily handle a wolf or two, but not a hungry pack. Yeah, true. I think so. He's pretty strong. He's pretty strong little pup. When he was only 60 pounds, He dragged me down the hill for about 40 feet. And he was only 60 pounds, so that's how much power he has. We're kind of going down the hill, and he goes after a rabbit, and he pulls me with him. I end up cutting my finger, my legs, my knees, everywhere. Tatka is a herb that people use it for liver and testosterone boosting effect. So in today's topic, I wanted to actually talk about, what's the main cause of heart disease? Because I've been getting, and I'm really behind. I like to answer every single question that I get from YouTube and TikTok, and I'm already behind about 4 days because couldn't type as much. I have about 140 questions to respond to, and most of the questions that I've been asked is, what is the start of heart disease? And I think there's been a lot of misunderstanding out there. Is it possible to overdo it with milk thistle, 3 morning, 3 at lunch, 3 evenings? No. You just over detoxify or overstimulate the liver. But you can't really overdo it. Yeah, I'm eating walnut. These are fresh. Yes, malic acid, so you can dilate the duct. I got these walnut from a neighbor of mine. He has actually a walnut tree, and he gives me a bag every year. Do I need to break the stones first, or is malic acid and lemon? You have to take the malic acid so you can open up the duct. If you don't open up the duct and you're trying to actually cleanse out the gallbladder stones, they can get stuck if your duct is very narrow. So malic acid that is found in apple cider vinegar, found in apples, or as a supplement, you have to actually take it every single day for at least 3 days before you actually do the cleanse. Duke has not stopped barking for the past 2 hours now. And on the last day, on the third day, when you're doing the cleanse at night, you're gonna be drinking 1 cup, I think I said 1 cup of olive oil and half a cup of lemon. So you can stimulate the gallbladder stones. But make sure your ducts are nice and dilated, nice and open, so you can pass all the stones. And it's gonna hit you in the middle of the night. Sometimes you might feel pain. Some people tend to faint from the pain. And you're gonna end up spending most of your time on the toilet. And everything is gonna float on the toilet. And that's how you know a lot of the stones are actually be passing through. Tatka is totally different than malic acid. Malic acid is good for the duct. Tatka is mostly for testosterone and liver support. So the activation of heart disease, is it modern West diet? It is. But the initial cause is when we actually destroy our endothelial system. This always starts because of high blood pressure. Duke is tough, but he doesn't have to kill most of what he eats. He's a big boy. He likes to play with animals. He doesn't kill them. The only thing that he likes to kill is mice for some reason. Mice and rats. I don't know why he's barking at. He's been going for the past hour now. Hey, Duke. You want some walnut? Come in. Come and have some walnut. Hey. Come. Come here. Duke. Come and have some walnut. He doesn't want any. We'll leave him outside. You want some walnut? Oh yeah. He likes walnut. He's in. It's right here, it's right here. I'm not sitting. We usually sit down. He'll have a piece and I'll have a piece. You want a piece? Here. Be nice. Yeah, for some reason he never usually barks at this time, but obviously something is bothering him. He keeps barking towards the side where the coyotes came yesterday. So maybe they could be there just hiding somewhere. Because I extended the land about 30 feet out towards the edge, so I can actually be able to get up in my truck and turn instead of actually always backing up. Come and have some, bud. Maybe he sees something outside. Possibly. I think maybe he does. Yesterday he wouldn't want to come in till almost like 9 o'clock. Then he came in. Then he slept, and about 2 o'clock he wanted to get up outside again. That's, I think, 2:30 or 3. That's when the coyotes came in. He has a good throaty bark. His bark's pretty loud, actually. Big feet, flea, and tur, but not a bear. Yeah, the bears are... it'll be interesting. Since I've had Duke, the last time I saw the black bear was last year. I think last year or the year before. We had a black bear. That's about... I haven't seen one this year yet, which is good. You want some? So this is Duke. He likes his walnut. I don't know if walnuts is good for dogs or not. I have to check. But he likes them. I think they're good for dogs. I don't know. He doesn't eat much. Only it's gonna be like once a year. Right, Duke? Here. Here's a good one. You want some honey with it? Intermittent fasting is good. When it comes down to intermittent fasting, there's 2 ways. If you're only doing intermittent fasting of 18 hours or 20 hours, for example, all you're doing is actually utilizing it more for weight loss. If you want to do intermittent fasting for autophagy and healing certain things, you should look into prolonged fasting, 24 hours or more. Keep that in mind. Because if you're just gonna do like what everybody else does, you know, a 16-hour or a 15-hour or an 18-hour, you're mostly gonna trigger the caloric deficit, and you're gonna trigger more of the weight loss. You're not gonna really heal the body in specific ways that you want. So if you're looking to heal, look into prolonged fasting. You know, whether you do 24 hours once or twice a week, or you do 36 hours once a week, or 72 hours every 2 weeks, that's the best way to do it. Do you prefer creatine, monohydrate, or HCl? HCl is highly absorbable compared to the monohydrate. Something is prowling around beyond the house lights. Something is out there watching and waiting. Are you experiencing a feeling of dread, or have a feeling of being watched? That's interesting. Okay, this one does not taste good. I'm not gonna give you some, Duke. Could be alien probes feeling out the cabin looking for... I have my blue roof. That will scare them off. Wait, Duke, that one was not good. I'll give you a piece. Wait. Let's crack open another one. If you know, you get used to it sometimes. If somebody's watching you and waiting for you, trust me. When Duke was only like 3 months old, every 2 hours he has to go to the toilet outside and poop. So imagine me at 12 o'clock and 2 o'clock and 3 o'clock going outside in pitch dark in my freaking boxers, holding Duke while he goes out and poop. And all you see is like eyes lighting everywhere in the crown land. Was it scary? Yeah, the first time, but after that you get used to it. He didn't let me sleep for a good year. Every 2 hours he had to go poop. If you do 14, 16 hours fast and you do it for a full month, your body will also trigger the healing. Very small amount. Very small amount compared to the healing. If you're looking to actually heal something in major, it's gonna take much longer of a time. How can I hit my protein goal? I'm avoiding most carbs. Need around 100, 120 a day of protein. Eat 2 pounds of meat. I eat 2 pounds of meat. That's 200 grams of protein a day. What's up, Maurice? Hey, Luca. Is 20 hours okay? That's the best I can do. 20 hours is good. Lately, my eating habits have been all over the place. How do you rediscipline yourself? Ted, what's going on? You were doing so great. How come you fell off? Increase your saturated fat and increase your electrolytes back into your diet. So you can actually feel a little bit more satiated. 20 hours is not bad, Ziggy. If you do 20 hours, let's say 3 times a week would be ideal. Twice a week would be ideal. So this, but kind of keep an eye on your thyroid. You should feel like you're being watched. There are plenty of us here. Guys, give me a second. Let me open the door for Duke. He wants to go outside. Don't be too long. Enough barking. Breakfast was half a meatloaf and 5 scrambled eggs. Perfect. Yeah, so it's T, Big T. I'm gonna call you Big T. It's easy to hit 120 grams of protein a day. 100 grams of 1 pound of meat. That's 100 grams of protein. I don't know why you're having a hard time hitting the 120. I'm avoiding most carbs, near around. Yeah, even if you avoid carbs, you can still do a pound of meat. That's 100 grams. And having a couple eggs, 4 eggs will give you another 20 grams of protein. So you can easily hit it. So my first meal this morning was 1 pound of meat with 3 eggs. This evening I had 1 pound of meat. I had 2 eggs. I had a whole raw onion, red onion for testosterone boost, and I'm testing. And now I'm just having some walnuts. So you can see how much protein I'm having. I'm having more than 240 grams, give or take. Hey Kira, how are you? If you're not feeling satisfied, eat more fat. Yeah, 100%. Eating more saturated fats will actually keep you satiated and full. Eating monounsaturated fats or polyunsaturated fats will actually cause you to actually be more feel more hunger. They're not gonna keep you as satiated as saturated fats. Hey Ben, thank you. Okay, I had 7 pieces of walnut. That's enough. If I eat veggies, I feel weak, but if I eat meat, I feel full. So why eat veggies? Forget veggies. Don't eat veggies. I barely eat any veggies. The only veggies I would actually eat is whatever I can grow, like say cucumbers or onions. That's about it. These are the only probably 2 that I would actually consume. I don't like meat. I'm 59. I eat full fat, everything. How do I get more protein? What about eggs? What about cheeses? What about fish? There's so many options out there other than meat, if you can't eat meat. The carb train keeps you on the track of constantly eating. Oh, 100%. 100%. You're never gonna feel satisfied. Hey, Duke, bark on the other side. Here, come in. Bark on the other side, please, not that side. The kids are sleeping. We have neighbors, they actually have kids. And they probably go to school tomorrow morning. He's barking towards their side now. Can carnivore diet reverse kidney disease? Possibly. Kidney disease usually happens because of the filtration of the kidney is failing. The question is, why is the kidney filtration failing? Usually it fails because of seed oils, heavy fructose, and certain process that requires filtration through the kidneys. So once you go on a carnivore diet, yes, of course you're gonna actually probably heal or feel a little bit better because you're not eating any of these food items anymore. Can you differentiate nitric oxide supplement to the one at the dental office they give? What do they give at the dental office? What kind of, they probably give medications and stuff. It's not gonna, the nitric oxide or the nitrate that I talk about, it actually goes after the enos, which is endothelial nitric oxide. Most of the nitric oxide out there that they actually give you as medicinal or for certain ways, they're actually induced enos. So it has nothing to do with the enos production. So there's about 4 different type of nitric oxide. There's enos, there's inos, there's mnos for mitochondria nitric oxide production, and what's the 4th one? Neural nitric oxide as well. So there's 4 different kind. Maurice, if you have a cheat day, try Snickers of Hanover, honey, mustard, and onion pretzel pieces. You crazy? You wanna kill me, Blaine? I haven't had stuff like that for years. The only thing I'm gonna do with my cheat day is gonna be some white rice. I'll probably do it like a white rice pudding with some dark chocolate and honey, and maybe I'll put some creatine in it, and D-ribose and a glycine to kind of enhance the sugary flavors in it. And I think that's how far I'd go for cheating. Can I still use niacin even if I have gout? I've been strict carnivore for 45 days trying to get out of allopurinol. Yes, you could. The only thing is you can't take a full dose of 500 milligrams because you're gonna actually aggravate your gout. Because what happens is when you take niacin, it does actually increase your uric acid. One of the best things to do is if you actually have a gout, is to take less than 100 milligrams of niacin per dose, but do it every 4 hours, and that seems to actually work. Every time I go after him, he goes outside. That was the face. My husband reversed kidney disease from 3B to 2. He stopped eating meat and lost weight. Yeah, that's good. That's excellent. It's not about stopping eating. It's not about stopping the meat. It's because, you know, the person is probably switching from like a standard American diet to whether going plant-based or going carnivore. Yes, you're gonna heal yourself because you're stopping all the processed, all the man-made crap. Very simple. But it's not whether you stop the meat. It's what you put on the meat that's actually causing the kidney disease. Meat has nothing to do with kidney disease. But they taste so good. I'm gonna try some, Blaine. I'll see if I can get any up here locally. Why do always feel horrible when I increase my fiber? Because fiber is bullshit. He's barking like crazy today. Fiber is bullshit, guys. You don't need fiber to have a bowel movement. Your small intestine, this is like, pretend this is your small intestine. So every time you eat, your small intestine is a muscle. So it kind of squeezes, contracts and relaxes, contracts and relaxes. When you eat fiber, all you're doing is pushing the food through without allowing your intestine to actually contract and relax. So that's the only reason sometimes you feel like shit sometimes. Seriously, when you eat fiber, because you're actually preventing your intestine from actually working correctly. So you want your intestines to work correctly by contracting and relaxing, so you can actually absorb all the nutrients. You don't want fiber to just push stuff through without actually getting the proper nutrients. Any nuts you recommend? The only two nuts that I recommend is walnut and macadamia, and they have to be raw. What does a carb load day look like for you, and what are the benefits of it? The only reason I do it to actually refuel my glycogen storage. So my first meal would be normal, which is 1 pound of meat with about 2 to 4 eggs, maybe a slice of cheese. That's my first meal. My second meal, will be strictly carbohydrates, it varies from being white rice, let's say for an example, anywhere from 2.5 grams to about 7 grams per 1 pound of body weight. And it'll just be strictly carbohydrates, no proteins or nothing, so I'm not causing any glycation effect, because all I want to do is just refuel my glycogen storage. So I eat that last meal and that's it. And I usually the next day, my first meal again, I usually fast anywhere between 20 to 24 hours. Do you recommend tuna? If you're talking tuna in a can, no. It drinks green smoothies and increase water intake. That's good. Great job. Is grain-fed beef still healthy to consume without the fats? You can consume it without the fats. I've had 4 heart attacks, 1 stroke, and 9 stents. I used to have one around every 3 years. Now it's been 7 years free of heart attacks. I think the biggest change I did was to get rid of stress. Stress does causes a lot of issue, but what causes stress? What activates stress? It's the food that we consume that actually activates stress. It's the food that we consume that activates stress. Now, in the meantime, till you fix your food and get rid of the stress, start taking L-theanine. L-theanine is an amino acid that actually allows the brain to go into a relaxation stage without overthinking stuff, of overdoing things or stressing. Stress is a big thing. We always worry about stuff. You want to take that worry off for good. Stress reliever, Marker's Mark or Jack Daniels? I don't know. I'm not a big fan of Jack Daniels. I like a single malt. Wine is good for stress. Wine is good. Wine is not bad. Just make sure, it is some organic stuff. I like wine. Wine is good. Food is the biggest direct stress of the body. Oh, 100%. 100%. You eat to fear a disease or you eat to heal one. And trust me, a lot of our foods, because it's been tempered with, we're not getting the full nutrient density that we require, especially for our brain. And right now, when we follow a low-carb diet or even a low-fat diet, guess what's going to happen? You're going to be even more stressed. Because your brain, considered your brain being about 80% cholesterol, you need the cholesterol to actually satisfy the needs of your brain. Certain brand of L-theanine you recommend, they're all the same. There's only 3 companies, 3 manufacturers that produce L-theanine. What are your thoughts on ubiquinol? You can get ubiquinol from eating beef heart or lamb heart. Do you recommend protein supplement powder? No, I don't. Anything that is protein powder processing is not good, because it's just going to cause more of an insulin spike. It's not going to satisfy you because it's already a denatured protein. I would never recommend any keto. It's better to actually eat eggs, eat meat. That's where you're going to get your clean source of protein. Exercise for stress, 100%. 100%. Do squats, push-ups, run, engage in any type of activities. I have a very high LP small a. What are your thoughts on supplementing with L-carnitine and berberine? L-carnitine and berberine is good. What lowers LP small a is a small dose of niacin taken every 3 hours. That's the only thing you can actually reduce it with, but keep in mind it does take anywhere between 3 to 5 years to actually lower your LP small a. LP small a, it is a major factor of strokes, but the problem is it will only actually activate or kind of cause stroke only if you have high levels of LP, PLA2, and MPO. ApoA1 is 135, ApoB is 105. Is this okay? Do the division. We're looking for 0.77 or less. So you take 105 divided by 135. We're looking for 0.77 levels. For me, most of the stress came from working. I fixed that about a year and a half ago. I'd recommend retirement to anyone. Some of us could retire early, Blaine. Some of us can't. But sometimes I think we all overwork for nothing. We all overwork to actually pay our mortgages. And I think that's a big stress for everyone. Duke, where are you hiding? Stop barking. Stop it. There's people sleeping. Sorry guys. Oh, he goes again. If one eats good food, their body can handle more other stress. Thermal, psychological, chemical stress. Oh, 100%. All it is the food. It's the quality of the food, guys. You cheap out on food, you're gonna have issues with your health. Seriously, as simple as that. Off a whole month for surgery, bladder. Now my knees are hurting so much just to walk. Suggestion? Surgery, bladder? So you removed the bladder or what happened? Hello Maurice, hope is all is well. As for me, feeling better and following your guidelines, thank you. I'm glad everything is working good. Valentin, keep me updated with everything. Excellent. I'm glad you're sharing that with everyone. Yes, my stress came from working and people. 100%. It's always that way. Seriously. I stopped dating also. Women are very stressful. Yes. Yes. Not all of them, but at least a good percentage. A good percentage. Sometimes they ask more than what us as men are capable of producing or giving. Let Duke answer some questions too. He can bark his answers. I'm gonna bring him in. It's getting pretty dark outside. Off the whole month. What does L-theanine do you recommend? What dose? You can go anywhere between 200 to 600 milligrams per dose on an empty stomach. You can go as high as 9,000 milligrams a day without kind of conflicting. It's actually very, very safe. Fixed it. Perfect. How about tocotrienols for LP small a? I played with tocotrienol. The only way you can actually use tocotrienols, you have to take in the upper 800 IU. And it works. And it has to come from NATO. So one of the cleanest source of vitamin E, it comes from NATO. So 800 IU, you just have to kind of keep in mind that it does thin out the blood. So you got to make sure you're not taking anything else. It's one of the best anti-inflammatory out there. If I can actually afford it, it's actually pretty expensive. If you get tocotrienols from NATO, that's the best one. You can actually lower your LP small a. A little bit faster than niacin as well too. Maurice, you are the best man. God bless you. Cheers, Captain. Thanks so much for the comment, as always. You guys been great. I'm trying to come here every day to actually answer a lot of questions. I know I've been off just because of my little injury. Fixed bladder through surgery. Now my knees are hurting so much. I didn't work a whole month. When you say your knees are hurting, is it when you're only bending or just pain in the knees, constant pain? So I'm curious to see how your bone density, but it should not really affect it from the surgery unless you end up having too much chemicals in the body that is being flushed out. It's hard to say. It's kind of tough. Are they both knees are hurting? Yes, you are a great guy to reach out and help total strangers. Cheers. Thank you. Is B3 500 milligrams good for long term to fix cholesterol? What's wrong with cholesterol? Why you want to fix it? Yes, niacin will actually prevent your cholesterol from oxidizing. What means when you get more gassy eating eggs, very sulfury, smelly, your body's not absorbing it correctly. It's not digesting it. Keep in mind the egg white, we're not supposed to actually absorb and digest correctly, most of us. At least 33% of the population, they cannot. So one thing is you can actually mix the egg white and the egg yolk together. That will actually reduce that. If you don't want to, just eat the yolk without the egg white. And usually some people have an allergic reaction. It's all about the source, where the source is coming from. Maybe the feed of that chicken or something is actually conflicting. All of a sudden, Duke is quiet now. I should go check on him to see if he's okay. I was brushing him today and everything. I noticed there was like a small cut on one of his paws. He must have cut it somehow. So I had to kind of clean it up for him and fix it up. I hope he's in the deck. How to recognize good eggs when you buy them? The shell has to be tough to break. That's one thing. The egg white has to be solid, almost not like when you break it, it just goes all over the pan. It has to be solid, and the egg yolk, of course, has to be like as orangey as you can get it. I think that would be the best thing we can do. What do you take to heal an injured shoulder? JD, all I gotta do is just hit my shoulder on couple 4x4s. I think I'll be good, and that's what I've been doing. It's getting better actually today. How's the building going out there? Are you a skilled tradesman? I think I'm getting there pretty good, but it's pretty dark. I can't really show you much, guys, outside. I have to go get Duke from outside. He's barking. I hope you and Duke are having a great week. Thanks, Pete. I really appreciate it. Thanks so much for the support as always. You've been great. Duke is doing good actually. He's just outside barking. He hasn't stopped for the past 2 hours. He's barking at the new section actually. We just cleared the new small section about 20 feet or so I can turn around and my car on the top, and he's just standing there barking. So obviously he's not liking it. He's not liking something. Do you have a private consultation? I would like to contact you to give me advice about supplements. Thanks. DJ, yes, I do. If you actually go to my picture profile on my main page, there's a website. If you click on the website, you can actually book a time as well too. Definitely go there. If you can't find it, send me a comment or a message. More than happy to send you the website. I had an appointment for a triple bypass 7 years ago. I told the cardiologist that I would think about it. He said, tell my secretary when you are ready. That's crazy. Yeah, these guys, they don't care. It's like you just come in and get it done whenever you want. No rush. It's only money in their pocket. Can you repeat your ideas on a creatine? My ideas on a creatine, what do you mean? Taking creatine hydrochloric acid instead of creatine monohydrate? Yes, my knees hurt all the time, both of them. Any suggestion? Do they crack at all when you're bending down or when you're doing like a push-up? My cholesterol is high because of sugar. Your cholesterol is high is because something is going on in your body. It's mostly your diet. Could be seed oils, could be many things that you're actually consuming that is actually going up high. I drink coffee black. That little bitterness causes me crave some sweet with it. I tried half a teaspoon of allulose tonight, and I'm really made the taste smoother. Not enough to taste sweet. Allulose should be fine. It should not really conflict with your insulin as much. But I would probably put D-ribose instead. So this is, you can actually boost your mitochondria instead. I'm just looking for my flashlight so we can go get a Duke from outside. I have heart palpitation after I eat. EKG normal. What can I do? Go download my ebook on how to fix heart arrhythmia. So you fall in that category. Cheers, Kiro. Thank you. How about consultation face-to-face? Yeah, I do all that consultation face-to-face. We can do video, we can do phone call, we can do whatever you guys want. Now, you guys, you probably can't see me that much because it's very dark. I have to go outside and get Duke to see where he's at. It's pretty dark. Because he keeps barking. Hey Mo, the taurine did not agree with my heart discomfort and pain. Any thoughts? How much taurine you're taking? Like 3 grams? 3 grams per dose? Or what's going on, John? Just so I can get an idea. Inflammation causes heart disease and arrhythmia. Well, what causes inflammation? That's the question. I don't know if I believe the cardiologist also did I really needed 9 stent or was it all about money? It's all about money. Keep in mind, every stent can cost anywhere between $10,000 to $30,000. When they put one for me, she's like, you're a lucky person. You just got a $30,000 stent in your heart. You should be proud. They're a bunch of assholes, to be honest with you, and it's all about money. Sometimes they see an artery that is like 30-40% clogged while they are already inside. They say, what the hell, let's put a stent there. And that's what usually happens. Duke, where are you? I can't find you. Why are you hiding there? Come up here. Duke. So dark. Good night, Maurice. Take care, DJ. For knees, sometimes hydrolyzed collagen can help. Look for full spectrum. Who was asking me that question? Was it Teresa? Yeah, Teresa. So I have Pete from YouTube. He said hydrolyzed collagen can help. Look for full spectrum. I don't know if you're still online or not. Maybe you can look into that. I know I was going to recommend the PRP and other injection, but maybe you can try the collagen, see if that would actually work for you first. Is it okay to eat raw meat? I usually put steak on a pan for 15-20 seconds one side and same on the other side. I'm just wondering, if I buy meat from the store, is it okay to eat it without cooking? Yes, it is okay. Now, keep in mind, when you're eating meat, I ate meat for almost like 4 years straight, and I still do it sometimes, about 80% of the time. So think of the steak as it has a small surface. So that means the surface of it, if it's gonna have any parasite, and you're already gonna probably fry it, maybe like you said, 15-20 seconds per side, and you're gonna eat it. Perfect. If it was ground meat, I wouldn't say yes to that, because ground meat has a much larger of a surface because it's been grounded, right? So that would actually contain more parasites sometimes if the source is not clean. But definitely, if the source is clean, you can eat it raw. Like I eat most of my ground meat. Mine is ground yak, actually. I get it from the farmer fresh. I eat it raw all the time, and I'm not really worried because I know the source. So it's all about trusting the source. Hey Maurice, what do you think about NAC? I take NAC daily sometimes, or sometimes I take it only when when it's required. NAC stands for N-acetyl-L-cysteine. Think of it as good for liver, but at the same time is gonna actually get rid of any mucus build up in your body. If you feel like sick, you feel like you're coming down with something, take NAC, but you gotta take it proper. 2400 milligrams every 4 hours, 5 days on, 3 days off. Maurice, you've got some great ebooks listed in your store for sale, some even free. Prices are very affordable. Thanks so much, Blaine. I hope everybody can see that message and they can hear me saying it. You know, there's a lot of ebooks out there, and you guys can actually support my channel in return. Or if you guys become a member of YouTube as well, it is going to help my channel to constantly grow. And the whole aim is in regards to heart disease, guys. That's all I'm aiming for. I'm not gonna mix up the channel with anything else other than maybe my little experience of me building a tiny house. Any topical cream for pain for the knees? Any topical cream? The only thing that I maybe would suggest, you can use magnesium chloride, but because it does absorb through the skin topically, I don't know if it's gonna help much with the knee. I've been using it on my shoulder lately since I hurt my shoulder. It's been helping. Maybe you can try that. I got some from Amazon. That was the only item that I can get from Amazon as fast as possible to get to the location I'm at. Red juice rice for lowering cholesterol while on carnivore diet, okay? If so, is it safe long term? It is, as long as it does not have a specific mold toxins. You have to check for it. I think it's called citrin. So make sure when you're actually buying red yeast rice, check with the company of the manufacturer and ask them for a certificate of analysis, and make sure it does not contain any citrin in it. Citrin happens when they're actually fermenting the rice. But the pain was really bad. How do I avoid the hospital when I have a chest pain? I don't want to go again because they want me for a cabbage, but vasodilate the arteries. When I end up having pain, after I had the issues and a stent, I would actually take nitrate supplement, and I've been on nitrate for 10 years. I will never stop because I'm constantly vasodilating the arteries. The only reason you might have angina or pain is just because due to the clotting, or sometimes the stents are not compatible with your heart, or something else could be that it's actually weak in the system, and it's a deficiency in as well in vitamin C and magnesium. JD, blood pressure a little high tonight, particularly DIA 138 over 96. Why the hell is it up high? From 120 over 80 to 138 over 96. You must have ate something that actually caused a slight coagulation effect. The question is, what the hell did you have in the last couple hours that kind of threw off your blood pressure? Or maybe you end up high, or maybe you just lost more minerals due maybe to more activities possibly. I hate salmon. Is that what you ate? You end up eating salmon. Probably is it farmed salmon that it's actually has flushed out your magnesium to actually break down the proteins in it? That's a possibility as well. You probably end up losing a little bit more magnesium than you are regaining. Is a salmon is a farmed salmon or a wild sockeye or wild salmon? I started watching your videos on YouTube. Zico, cheers. Thank you. Great. Thank you very much, Maurice. I heart palpitation after eat, EKG. Wow, that's interesting. So the only reason that would end up kind of increasing your systolic and diastolic, did you eat the skin with it? Never eat the skin. JD, if you ate the skin, that sometimes does happen. No skin. I wonder what actually reacted. Because usually, so the only time we see diastolic and systolic go up is something that was consumed but was not kind of compatible with the system that end up causing a slight elevation. The question is, what is it? Is it the source? Is it the way it was cooked? So sometimes we always have to kind of question these things. But as long as your blood pressure goes back to normal within an hour or so, I'm not feeling ill or bad, totally normal. Okay, then that should be fine. I don't think it's something to worry about unless it's gonna actually end up prolonging, let's say, till next day or something. Then we can have to look into it. But usually, high protein intake does require a little bit more magnesium because we end up utilizing magnesium a little bit more. But yeah, for it to kind of fluctuate like that fast from the last meal, that's kind of interesting. Very mild angina. Take a look at hawthorn extract. Hawthorn extract works really good as well too. If that's what's happening, I don't know who was asking that question, because he keeps having every time he has pain, he end up going to the hospital and they end up want to push him to get a stent. I'm not feeling ill or bad. It was 120 over 80 at 6 a.m. today. Okay, so that's not bad. Then in the evening, you just kind of increase. Something must have kind of either lost in the system or something kind of got thrown off balance. That's the only reason. Had first doctor visit after carnivore. Predictably, he went right for the LDL issues. A1C 6.5, set my AMT, exogenous insulin. LDL 170, off blood pressure meds. Oops, I missed the question. Triglyceride 149. Is wild caught fish, Alaskan salmon, okay to eat raw? I heard they have a lot of parasite. Is that just fear mongering? You can eat them raw. The only thing is you have to be careful. So when I eat the fish raw, you have to actually, so I skin it. So I take the skin off. I kind of fillet the fish and let the fish sit for about 10-15 minutes. If it does have parasite, they usually will pop to the top surface, and you'll see like a little white dot, and it's actually moving. If you don't see anything like that within 15 minutes, so what I usually do is I put a little bit of Himalayan salt on it, and I put a piece of napkin under it. And what I do is I put it in the fridge for about 2 hours. So what happens is the salt is gonna end up soaking all the water out, so it becomes more of, let's say, cured. Technically, to be cured, it takes at least 4 to 6 hours, but usually I do it for about an hour. After that, I take it out, I tap it dry, and I just slice it very, very thin, and that's how I eat it. I've done a lot of videos like that almost 2 years ago on YouTube. How I was eating my sockeye wild salmon raw. Captain, awesome. Thanks so much for the support. Really appreciate it. Glutathione injection once a week, 1 ml, 200 milligrams for liver support. How long should this protocol last, in your opinion? It depends. You can actually get, so if you're trying to actually fix your liver issue with glutathione, it's going to work really well. The only thing is you gotta do is, the 200 milligrams, 1 ml, which is excellent for the liver. You can actually, if you have, let's say, a fatty liver disease, you can actually get a small test on the liver and you can check to see how much fat is in it. Let's say, for example, we want ideally to be below 5%. Anything above 5%, obviously there's issues. But the glutathione, once you take it, usually I like to do like a 4 weeks on, 2 weeks off, and kind of see how you feel. When I did the glutathione when I was as a IV therapy, right now I'm doing actually the liposomal and I'm testing it out. Like I take about close to about 2,000 milligrams of liposomal right now, and I do it 6 weeks on, 2 weeks off, and kind of see how I feel. But this is all in regards to your liver, and the first thing you're gonna notice is that your cholesterol does not go as high. um, your your AST, ALT numbers, all that stuff will become perfect, and you're gonna notice you're actually sleeping better, and you're gonna notice that you're what else you're gonna notice actually? Well, it depends. It depends what are you doing it as well too. Would definitely like to know what's the reason behind it. If you're looking to actually cure something in specific or not. Can anyone see my comments? I can't see anyone's comments. Maybe you're blocked. You recommend any peptides for clogged arteries? There is a peptide that I actually talked about. I gotta look it up in my cheat book that I wrote it. There's a peptide for arteries. Yes, I haven't tried it yet, or haven't had anybody from my current patients try it yet. Right now, we're actually trying one that is an enema by Cavadix. Any recommendation for low blood sugar, heart palpitation after eating? I The only reason that happens is because you're not consuming enough potassium or magnesium. Would the nitro spray be enough to get rid of a very bad chest pain and avoid the hospital? And should I ask for the doctor for nitroglycerin spray? The nitroglycerin spray is gonna vasodilate your arteries temporary, but most of the time, if you have pain, it's not gonna really work. But Pete earlier, I don't know if Pete's still online or not, and he said, you can definitely use hawthorn extract for angina pain. I use nitrate myself. Now, the nitrate that I use is actually vasodilates the arteries for much longer of a time, almost 8 hours. You can maybe try the nitro they give you at the hospital, they give you at the doctor to actually keep in your pocket as an emergency and see how that works. See if it actually gets rid of any of the pain. There's one product that I came across. I'm gonna grab it here. I've had it for almost a year now, and I haven't actually used it. Let me get it. I'm gonna show you a name. It was actually invented by in Japan. It was invented in Japan. They gave me a product. They gave it to me to actually try it out, and haven't opened the bottle yet. And it's supposed to be actually for anybody who has like angina or any type of pain. Let me grab it here. I'm gonna show it to you. Hopefully I can find it. Hopefully I can find it. I can show you the bottle. Oh yes. Look up this one here. I don't know if you can see it. This was a product that was sent to me to test out. I haven't had a chance to test it out, but it's usually for people who end up having angina pain. Can you see it? This is Wonder Men. So this is the name. If you can get a chance to see it, go for it. Hi Maurice, more to your left. Oh, there, this one. Yeah, this product that was just somebody was asking me about it is actually it's manufactured and everything. It is here. They actually the distributor for this product is here in Canada, but they actually the main manufacturer I heard there is from Japan, and they actually use this product for any like heart pain or angina and stuff like that. So definitely you can look into it. Or what Pete said earlier, you can definitely look into hawthorn extract. Me personally, I like nitrate supplement. The one I take, nitrate supplement, I have it on my website actually, where it vasodilates your arteries. Um, yeah, the FDA did put a warning, but it's nothing to actually worry about. All my patients are currently doing it right now, Zico. So far, a lot of them been on it for almost about 5 weeks since my video was launched on it. Angie, I would actually add some magnesium so you can actually regulate it, or actually add more salt to your diet so you can actually fix the issue. Wonderven Man. Did you see the picture that I sent you? This is the one I was talking about for the product. I don't know if you're there still online or not. But yeah, this is the one. Let's see, when does it expire? 7/25. Maybe I should try it to see what it feels like. I took a screenshot of the product. Yeah, I have. To be honest with you, it was sent to me, and it was sent to me from the company to actually try it out. It's supposed to be like anybody who's actually having pain, mostly, so angina pain. So definitely check it out. Keep me updated. Let me know, because mine, the one I have here, I have not opened it yet. Um, I haven't really had pain for more than 10 some years, but I know in the beginning I did, and I got rid of it from doing just a nitrate. Found the name of the peptide for arteries. No, I haven't. I haven't turned on my computer yet, but there is a peptide you can actually do. Yeah, you definitely don't want to go to the hospital. You definitely want to fix the issues, and you definitely want to actually clear things up. But I would highly look into go watch my latest video. I don't know if you have in regards to Cavadex as well too. Maybe you need to try something like that as well too. How tall are you, Maurice? You look like you're 6'2", 6'4". Wow. 6'2", 6'4" would be awesome. The only reason I look tall maybe because my trailer roof is so freaking short. Hi, Maurice. I was set to give a nuclear stress test with imaging, and insurance denied it me the day. If my appointment, so they denied it, really. No worries. I will do a consultation with you soon, Zico. Sounds good. Sounds good. I'm gonna get you the name. I just unfortunately I don't have my computer on right now to actually go for look into it. Yes, Cavadex. A giant in his tiny home. Yeah, no kidding, eh? Yeah, I can touch the ceiling so easily. No, I'm pretty short, guys. I'm pretty short, Captain. I'm only like 5'8", 5'9". That's it. Maybe the camera's making me look tall and big. Maurice, did you keep a cool head when you had your heart attack? If so, how did you pull it off? Um, so what happened is, um, I was outside of town. I was in Cochrane. So Cochrane is roughly about 30 minutes away from Calgary, and I just bought a new condo there. So I was super excited. I was driving there to actually look at it and everything because I took possession almost about a week before. And while I was driving there, I had like a slight pain in my chest, but didn't really care much about it. So I went, and as soon as I went inside the house, that's when I started to have like a little bit more of a deep pain, and it was kind of uncomfortable. So I thought maybe it's just hunger. So I went and I ended up having a plate of rice and meat, and When I end up eating and finish the meal, the pain start to actually get very very heavy and stuff, and I felt like the food is getting stuck, so I didn't feel really as good. Went back to the house again, and it's funny, the place where I end up having the food, it was like a sushi place. The hospital was like almost next door, so I went back to the house, and that's when I start to actually sweat and shiver at the same time. And as soon as that happened, I knew I was having a heart attack. So I ended up taking 1/4 teaspoon of salt under your tongue. So the salt technically is supposed to actually vasodilate your arteries and gives the body the magnesium and potassium that it needs. And while I'm doing that, I called the hospital. I'm like, where are you guys located? Because I think I'm having a heart attack and stuff like that. And she gave me the directions. I'm like, I'll be there in like 2 minutes. So I went, jumped in the car, and I actually drove myself there. I went through two red lights. I dropped my car off on the side of the road, and I actually went inside the hospital. And the first thing they do is they stick a needle in your stomach. And what they stick in your stomach is magnesium sulfate. And they stuck one, and I'm still sweating and everything, and they stuck another one, and they said, oh, you're experiencing a heart attack. So I'm like, okay, give me a quick minute, I have to call my brother and let him know I am okay, but I am in the hospital. And that's how it all happened. And they actually put me in an ambulance and took me to Calgary. But that's how everything kind of started. um, do you panic? Kinda. You feel a heavy pain in the center of your chest and in your upper back as well too. But I was able to drive. I was able to take myself to the hospital. I was able to actually do all this stuff. It's kind of interesting the way they actually do it for you. And they end up kind of spraying so much nitro under my tongue to actually vasodilate my arteries to get rid of the pain. The pain stayed there till I was on the hospital table while they're actually operating. What age were you? I was only 33, very young. Maurice, he is not overly tall, but he's a big man inside out. Cheers, JD. I'm trying to be like a happy man all the time. Much appreciated your live stream. Cheers, thank you. More to the left for TikTok. Somehow you are not centered on my screen. I'm trying to kind of center myself on YouTube and on TikTok because I have both live going. And keep in mind, guys, everything that we talk about is all recorded on YouTube. So if you guys miss any questions, you can definitely get it there. But you can see me half in on YouTube and half on TikTok, guys. Yeah, I was very young when it happened. I was at my optimal level. I was roughly about 200 pounds. And I was at my top peak, and that's when I ended up happening, and that's when it changed everything. And that's when it changed everything in my life. What caused it? So prior to that, people don't believe it, but I was actually eating more vegan for almost a good 6 to 9 years, give or take, because um, the doctor, that's what happens technically. The doctor said, well, it runs in the family that you have high cholesterol, so we have to put you on statins. So I was on and off statins from the age of early 20s, on and off statins. And at the end, I said, I don't want to do statins anymore. He said, well, if you don't want to do statins, then you have to go and eat like a vegan diet. So I started the vegan diet, felt great in the first year, 2 years after that. I couldn't sleep. I'm constantly, having gases. My insulin spikes so high, and you're constantly hungry. You're constantly hungry all the time. So anyway, after when I was 33 years old, when I end up having the incident, I did what is called a vitamin, mineral, amino acid status, and I was pretty much deficient across the board with everything. I looked, even thought I was at 200 pounds. I did have a lot of fat, but I was very frail, almost looking. So that's when I dropped everything. When I came back home, I was released from the hospital about 3 days after, and I fasted. That was the first time I ever fasted, and I just sat there and I started reading. And the only thing as I was eating was meat. Every day I would eat like 2 pieces of meat, going from a 6 meal a day to 2 meals a day, and just eating meat for almost a couple days till I figured out what's going on and what happened. Wait, so you're kind of short, under 6 feet. It amazes me the big guys I see on here are shorter in person. That's funny. That's really funny. Thanks, Sean. Really appreciate it. Um, much appreciated your live stream. Cheers. Thank you. What caused it? Your streams are always very informative. Thank you, Pete. I really appreciate it. Really appreciate the support. Does sprinting really works? I would highly recommend more of high intensity interval training, especially if you're looking more in regards to the cardiovascular issue or to kind of enhance your heart. HIIT training would be like your best ideal scenario. Doing it probably 3 times a week, possibly 25 minutes per session. Pretty much that's all you need. That's all you need. Instead of kind of going on a long sprint all the time. You're gonna actually overstrain your heart. You're probably not gonna recover as good. Hey Marie, how are you? How's your shoulder? Shoulder is doing better today, Ashley. That's why I'm here. I'm able to move my hand. I can't really lift it higher than this. As you guys can see, it still hurts if I go higher than that. But it's getting better. It's pretty tight up here. So I've been putting a lot of magnesium chloride and massaging it every night before I sleep. It's getting there, but it does hurt still. Does Cavadex reduce self and heart place? And where can I get it, please? Yes, it does. And you'll have to go onto my website, and I do have my practitioner code so you can get 20% off. So keep in mind what's inside soft plaque and what's inside calcification. I mentioned this as well before. So they both have oxidized cholesterol in both calcified plaque and soft plaque. And the other substances and the calcifications, you have calcium phosphate as hydroxyapatite, you have proteins and fibrin, such as fibrin and other things, and debris. So yes, Cavadex is gonna remove the majority, which is anywhere between 20 to 40%. Now the other have to be removed with other supplementation. Excuse me, such as EDTA, vitamin K2, neurokinase, serapeptase, magnesium. But your first batch that started this issue is the oxidization of your lipids. 2 times a week sprinting is good. Should be fine. Should be fine. Twice a week would be great. Good. It's a bit better. Thank you. It is. It is actually getting better, Marie. How would I lower triglyceride and increase HDL? You can take niacin, but I would actually look into the diet. Look into your diet, what you're eating. Any advice for families trying to eat right and stay healthy altogether? Just get rid of all the processed and all the seed oils from your diet. That would be like your first step. Seriously. Once you finish that first step, then we can actually look into other things we can do. Recently found your channel. After doing some diving, I'm adding K2 to my stack. Perfect. K2 is excellent for your stack. And make sure you're taking like the correct amount. Let's go see what Duke's still barking. Still barking at that place. Maurice, were you able to play the piano after your heart attack? Play the piano? I think so. I never really played the piano. But after the heart attack, I went and got an ultrasound, I think they call it, and my ejection fraction was only at 30%. So it was like really, really bad. And the doctor said, well, within 2 months, we're gonna do another surgery if it stays that low. And that's when I came up with that stack. That I came up with that stack after doing so much research. And when I went back in 3 months, my ejection fraction went from 30% to the upper 80s because I recovered my heart very fast. Hey, Duke, Duke, enough bark. Shoot, we lost the signal. when I was outside. Yeah, I have to go get a Duke because he's barking like crazy. Losing your signal. You guys got me again because I know I lost signal when I went outside. Give me like a minute, guys. I'm gonna go grab Duke. Try to kind of get him in. You guys don't go anywhere. You guys can hear me good? Is he okay? Yeah, he's okay. He's just barking. He has a non-stop. I'm gonna go get him. I'll be back. He's not coming in. I'll have to go try again because starting to rain is gonna get wet. %. I am alive again. Yeah, 100%. It's was brutal, but was not bad. I'll stay for another 15 minutes till it hits probably 9 o'clock. Then I'm gonna go try to hunt Duke down again and get him in. Because that white light hurts my eyes. It's so freaking bright. Hi Maurice, how can LDL be lowered? See, LDL, think of LDL as a lipid carrier. So it carries fats in your body. So what increases LDL is pretty much saturated fats increases LDL, but it doesn't mean it's bad. The only reason it becomes bad only if it's actually you have an injury in your heart or your artery, let's say, then your LDL will start to oxidize. That's the only reason it becomes bad. But it doesn't mean you want to lower it, because LDL is what actually helps your hormones, your brain, your fat carrier, your energy. So it does a lot of good things. But the question is, if you already have damaged arteries, then your LDL is actually being trapped and getting oxidized. So you don't want to lower them. No. You can't just off the start and say LDL is bad. You know, back in the day, if you go back 40, 50 years ago, you got these people in white coats. They sat on the table and said, you know what? Let's call HDL a good cholesterol and let's call LDL a bad cholesterol. They came up with that concept and they're stuck in everybody's head. There's no such thing as good or bad cholesterol. LDL takes your lipids and actually sends it out in your, transfers your lipids around your body, and HDL cycles your LDL back to your liver. The only reason LDL becomes bad only when it gets trapped in your arteries if your arteries are damaged. That's it. There are doctors saying that instead of LDL, the important ratio is triglyceride to HDL ratio. Correct. So if you take your triglyceride and divide it by your HDL, your optimal results should always be below 1. If it's above 1, that means you have a metabolic issue. And usually that by itself, when you go triglyceride divided by HDL, if you're above 1 or above 2, that's how we know if a person is actually insulin sensitive or insulin resistant. Then we know for a fact if you are insulin resistant, your HbA1c levels would be way higher than 5.1%. Ideally, we'd like it to be about 5.1% maximum. Yeah, ideal. It's true, JD, what you're saying. Ideal is below 2, but for optimal results, especially anybody who's actually family history or anything like that, we always look at it to be below 1. Below 1. And being on a carnivore diet, it is going to be below 1 as long as your body is utilizing some of the fats you're consuming. So, swag, if you have no artery damage, then there's why should you worry about lowering your LDL? As simple as that. Is xylitol safe as sugar replacement for heart patients? Please and thank you. Yes, it is safe. 100% safe. And it's really good for your teeth as well, too. I tell my sister everything you teach us, but people are so dumb they want to believe the dogs. Well, they do. It's that's how it is. Everybody has somebody to believe. A1C is high 7.4. I'm working on it. Well, 7.4 is quite high. 7.4 already in the pre-diabetic zone where you could actually have some type of damage or something is going on that needs to be fixing. By HIIT workout, do you mean running? By HIIT workout, high intensity interval training, it does not have to be running. It could be done with weights, where you're lifting, heavy lifting instead of doing, let's say if you're doing deadlift and if you're doing 100 pounds deadlift 12 times, well, I would say, go ahead and do that lift 200 pounds and do it only 4 times. That's almost like a HIIT. So you're doing heavy intensity training, heavy resistance training. Maurice, sell it on your site. Is it safe and good for teeth? Yeah, xylitol is good for the teeth. I actually use it. I put like a 1/4 teaspoon and I actually swish it with my coconut oil as well too. C-reactive protein, that's inflammation in the body. Magnesium will fix that for you. People want to believe. Oops, you erased the message, Blaine. I was about to read it. You beat me to it. But yeah, you can use xylitol. You can use it with coconut oil for pulling. I use as well. What else do I use? You can use colloidal silver as well too. Would actually work for your teeth. So there's a lot of things you can do. And xylitol is good as a sugar molecule. Does not spike your insulin as bad. A while ago, I downloaded Maurice's ebook, High Blood Pressure is Fixable. I highly recommend it. Very detailed. Thank you, JD. Really appreciate your input on that. And thanks so much for posting that out. Guys, there's a lot of great ebooks on the website you guys can actually download and actually you learn a lot of things from it and how you can actually reverse some of these issues. Hungry, dizzy, and no energy, but my blood sugar is 6 or even 7 sometimes. Your lack of minerals. Does D-ribose increase sugar level? Is it safe for people who are it is safe for people who are diabetic? Yes, and the only amount we take is roughly about 2.5 grams per dose, no more than that. Oregano oil is good too, yes. What's going on, Pioneer? I'm not sure what you mean. You're hungry, dizzy, and no energy. But my blood sugar is 6 or even 7 sometimes. Give me more information. Do you know why I cannot get a calcium scan anywhere? I've tried in Canada, Florida, Texas, and they all said no because I have a stent. Because what happened is the stent will register as part of the calcium. That's the only reason. So the only test you can get, that's why I can't get a test either. They won't actually take me in. So the only test we can get is called CCTA. Your stent will show up as calcification, but the CCTA has like almost like a 3D module. What it does is check for soft plaque, and you end up gaining more benefit from the soft plaque. Who cares about the calcification, because the stent is gonna look like a calcification issue. So even thought if you don't have calcification, but the stent will show up there as a record. So try to get a CCTA instead of a CAC score. Marie, thanks so much for the comment as well. Yes, his book is great, especially one-on-one. My knee pain, floaters, and all gone thanks to him. Cheers, Marie. I'm glad everything is working excellent. Guys, I'm gonna stay another 10 more minutes and I'm gonna go outside and try to grab Duke because it's starting to rain. He doesn't want to come in. He likes a new section. He goes there and he plays and he's barking like crazy. Latro, no problem, anytime. Yeah, very light rain. JD, have a good night. Give Duke a good scratch for me. Cheers, will do. Thanks so much for coming out. You have a good week ahead of you. When I wake up in the morning, I feel hungry and dizzy, but my blood sugar is normal range. It doesn't have nothing to do with your blood sugar. It's mostly your electrolytes. So what you should do is when you wake up in the morning, grab your Himalayan salt, grab a 1/4 teaspoon, and take it in. That will fix your issue. You need some electrolytes. Seriously. Some good quality electrolytes. And I have the link in my profile bio if you want. Where can I get a CCTA scan? I'm interested in Cavadix then a scan. I can help you with the Cavadix. You can actually don't forget to use my practitioner code so you can get 20% off. CCTA scan, you have to check locally where you're at. You'll have to call some places private probably and ask them if they do any CCTA scans, and you should be able to get it. And that will actually then you are up in Ontario, yeah, you should be able to get it. I'm in BC right now. I am in Canada, but the area I'm in, they don't have it. I'll have to go back to the city. I'm not sure how much it costs. You have to get it privately, or else you're gonna wait almost like a year for a freaking doctor to get you in. Do you sell your own vitamins for blood pressure and diabetes? I don't sell no vitamins or supplement. I just post the links from the current companies that I get it from, like iHerb and others. That's it. I don't carry anything myself. I just put them there just for because a lot of you guys ask me about them. So that's the only reason I put them. How about Celtic salt? Celtic salt works not bad if you can get some good quality ones. Your subscriber count is going up. Lots of long hours and hard work. It has a lot of hours, a lot of hard work. Blaine is trying to pay off, and I think it's starting. I'm getting close to my 10,000 subscribers. I think that's awesome. BC, I so wanted to meet you because I so wanted to meet you. Because sounds good. I'll be in BC in December. CCTA available in BC. I'm not sure if it's available here. The location I'm in is a little bit off-site. Closest city to me here in BC, I'm almost like 5 hours, 6 hours away. So I don't know if there's any here. I haven't checked. I'll have to be going. I'll be going to Calgary to see if I can get one there in December. Not anytime soon, actually. But I'll have to check to see in Canada who has it. But yeah, you can maybe go online and see who does the CCTA scans. Is stevia Reb A and 98% bad? It's in my electrolyte powder. So they're using stevia for the sweetener. It's not whether it's bad or not, because when I read about stevia, there's two types of forms of stevia. There's a stevia as being a white powder, which is actually synthetic. And there's a stevia that actually comes from the green leaf. That's the one that you want. It's more natural, but still, no matter what, still causes a slight spike. And it still kind of counts as calories, for example, which is fine because that is part of the electrolytes to kind of give the electrolytes some taste. That's why I like the trace minerals that I have, because it has no flavor at all. It's just, it tastes very salty. I don't like stevia myself, to be honest with you, is just because due to the insulin of due to the spike of the insulin. But I'll have to look into that. Reb A. I don't know what you mean by a Reb A. I'll have to write it down. I don't have my computer on right now. If you don't mind maybe sending me that as a message, Pete, I will check it. But if it is coming from a green leaf, it's good. If it's coming synthetically, I wouldn't recommend it. So BC is your hometown? I am in BC, yes, right now. And during the winter time, I've been heading to the city in Calgary. I'm a nomad traveling from Nova Scotia to BC every year. I'll check Calgary for CCTA scan. Sounds good. Yeah, let me know. Let me know if you find any. I haven't really looked into it. I know when I go back, I'm gonna look into it as well too, to see if they actually have the CCTA scan. Best weed in BC. Cheers to that. Cheers to that. I gotta go grab Duke. He's barking like crazy non-stop right now. I don't know what's wrong with him. I'll stay for 4 more minutes, guys. Whoever had any specific questions, I do apologize if I couldn't give you a good answer, but I'll definitely look into it and search it up. So please post it as a comment, send me a direct message, whichever is easiest for you guys. I'll definitely respond. Can I quit Cavadex after 3 months? Yes, you could quit Cavadex after 3 months, 100%, but we should actually figure out, we don't want you to kind of quit after 3 months and the calcification comes back. We want to make sure we're fixing that lesion. Very expensive, yeah, but it's a fraction compared to your health. 100%. That's the way you have to look at it. Even every slight percent we reduce, every 2% we reduce, that's 50% less of a heart attack. So I'm going to consult online regarding my husband. Sounds good. Looking forward to it. Thank you. Have a great night. You too, Phoenix. Cheers. What can be used for heart failure? It depends what I need more information about heart failure. That's such a broad question. Take us out there with you to get Duke. It's very, very dark, and trust me, I need both hands, but let's try it. Let's see if we can go out and get him. You guys are not gonna see anything. It's pretty pitch black. I hope he's here. Where is he? It's like dark. And I don't want to go on the bottom. I'm gonna get my feet full of mud. Where is he? Let's see where he's at first. Can't see him. Oh, he's sitting on the deck. I'm looking all the way there and he's sitting right here on the deck. He's tired. Oh, there he is. Come here, little boy. Let's go inside. Come on, come on, come on. Good boy. Hold on, let me open the door. That was easy. That was easy. What, you played? You had your fun? You're sitting for me on the deck? Come in. Duke is here, guys. He knows it's time for him to sleep. Good boy. There, can you guys see him? He's right behind me. I got him. Where is he? See, he's drinking his little water. There you go. I took you guys out for a nice little walk. Pitch black. In the summertime when it's pitch black, we can actually see a clear sky. Like you can see the stars and everything. It's actually nice. Right now it's like very, very cloudy. I think it's gonna rain soon. Yeah, it's pitch black there. There's no lights, there's nothing. And if you have any type of light, you're gonna end up having like big bugs hitting you left and right. How will I know to quit Cavadex without a CCTA? I would highly recommend getting this. That's why I highly recommend every person that is actually doing the Cavadex to actually get a CAC score or a CCTA score, so we know where we're at. I don't want you guys, and I don't want people, and I don't like the idea of anybody just taking supplements for the hell of it. For the hell of it, without doing like further testing, because further testing is going to give us a very, very clear picture of what's going on, and now we can actually treat the issue, whether we need certain supplements, certain therapies, certain IV therapies, or chelation. But we need to get the testing done, even though the testing is expensive. But that's going to give you a better look on your heart, a better avenue to see exactly what's happening. And yeah, after you do the Cavadex, then you can do another scan. It is an investment in your health. You can do another scan, 6 months down the road or 3 months down the road, and now you can see, okay, I went on Cavadex and I actually reduced my calcifications by 30% or 20% or 10%. And that's what we're looking for. And that's exactly what we're looking for. He's trying to go through my screen door. Duke, stop it or else I'll close it. Stop it or else I'll close it. Go to sleep now and don't rip the screen door. Go to sleep now. Good night, Maurice. We chat tomorrow. Thank you for everything you teach us. Cheers, Marie. Have a nice evening. I'm going on Cavadex probably just a month, but at least it's something. Doc is testing before and after 1 month and we'll review. Sounds good, Kerry. Sounds good. Keep me updated. Let me know. But seriously, guys, you guys have a nice evening. Take care. But seriously, anybody who's doing anything, I know you guys hear a lot of influencers. They talk so much and so much information about so many different supplements, and sometimes we find it being so cool, or it makes sense, so we end up buying it and trying it and a lot of things like that. But it's always good to do the research and find out whether your body requires it or not. Don't just jump into it blindly, because if you're gonna just jump into supplements blindly, trust me, you're gonna have a whole store in your house with so many supplements. Yeah, there's Duke. He's a little baby. You guys can see him. He's a big baby. He wants his love before he sleeps. Did you have fun outside? Your face is full of mud. What the hell did you chew on? What is this? What is that? What the hell did you chew? You dropped it on my bed. Okay, relax. Okay, relax. I'll give you some love. Okay. Ow. I'm not going anywhere, you goof. I don't know what the hell did you chew on. What is that? Why am I smelling it? I take a lot of supplements for my heart, 100%. Like we all need these supplements, whether it's D-ribose, creatine. It's all about mitochondria. You boost your mitochondria, your heart is gonna thank you. Your mitochondria is very important, and that's what actually keeps your heart flowing correctly. Some people on TikTok is selling healing herbs, claiming it will help with you different diseases. Yeah, you guys gotta watch out. There's a lot of affiliates out there, a lot of influencers that are just selling things left and right. But seriously, we have to actually break things down in specific and find out exactly what works for you and what works for others. What do you think about Beat Elite supplement for nitric oxide? See, there's another bullshit product. Beat Elite. The problem with it is it's not extracted properly from beet, so therefore it's not gonna even spike or activate your nitric oxide. For a fact, to activate nitric oxide, you need 500 milligrams of nitrate. You know how much beets you have to take to get 500 milligrams? That's 300 grams if it's not extracted correctly. So if they selling you a whole box of 300 grams for like $40, $50, you're wasting your time and money. What to take for heart health? The first thing you can start taking is magnesium for your heart health. Because once magnesium becomes deficient, you're pretty much welcoming heart attacks to your body. Very simple. Keep in mind, calcium contracts, magnesium relaxes. Without magnesium, your arteries will start to actually become stiff. And that's where you end up causing injuries. So calcium contracts, magnesium relaxes, and that's what we need. Our diets are very high in calcium and not enough magnesium to allow our arteries to actually relax. And that's why we tend to have blood pressure issues. And that's how the lesion starts in our bodies, in our system. Guys, I passed my time. I know I wanted to stay here till about 9. It's already about 10 after, 5 after. What kind of magnesium? It has to be magnesium ionic chloride. Where can I get a good nitric oxide supplement? Go to my website. Under the supplements and herbs, you can see the one I've been using for the past 10 years. It's actually, it lasts about 8 hours in your body, and it does give you the proper amount of nitrate per dose. I take neurokinase, magnesium K2D3. Neurokinase 12,000 FU, magnesium 200 milligrams every 4 hours, K2 500 micrograms daily, D3 1000 IU per 25 pound of body weight, berberine 1000 milligrams daily with resveratrol. So you can actually, it works as to prevent lipid from oxidizing. Ecosapent ethyl softened vessels. I'll have to look into that. I haven't heard of that before. So like I said, there's a lot of supplements people can take, but the question is, are they taking it correctly? And are they taking the correct dose? Sometimes the dose that we actually just look at the bottle and we take it, all it is just to kind of keep our body in a maintenance mode, but we're not really looking after healing our body. So to heal your body, you have to use mega dosing at a specific time, specific way. And taurine. Taurine is going to be your favorite friend. And see, every person that has a heart attack, they're actually deficient in taurine. Every single person. So taurine as an amino acid is required to allow magnesium to get into the cells at the cellular level. So taurine is very, very crucial in this aspect. I even give it to Duke, to my dog, because they actually end up having heart attacks as well too. And that's why if you look at their kibbles as well and some of their foods, their taurine is like listed number 5 or 6 in their ingredients because they need it as well to maintain a healthy heart. Why do you think they even put taurine in energy drinks? To prevent the heart from seizing, from too much caffeine. So taurine is very, very important as well. No, go to sleep. How much taurine? I take about 3,000 milligrams 3 times a day. So I reach about 9,000 milligrams a day, and I mix it with about 200 milligrams of magnesium and trace minerals. Every single dose, I take it. How do you know you've had enough of that supplement without testing? The problem is you will never overdose on taurine. There is no side effect. And the thing is, in the modern living, in the modern life we live in right now, taurine is heavily used because it's one of the best products to actually help with detoxification. So every time you smell car exhaust or carcinogenics or anything outside, taurine is heavily used in the body. So it is ideal to actually have taurine enough in your body to actually work in the process of detoxification as well too. And it does act as an anticoagulant. Duke, you're not going outside anymore. So my recommendation on taurine has always been 3,000 milligrams 3 times a day. After 90 days, you can drop it to 1,000 milligrams 3 times a day. But it is ideal to actually mix it with magnesium because it actually helps magnesium get into the cells properly. So you can actually absorb as much magnesium as possible. What are the best supplements to remove calcifications of artery? You should go watch my latest video on YouTube. I'll give you all the answers you need. Mishka. Duke. Go to sleep. You're not going outside. Okay, I'm going to take one more question and that's it. I'm going to call out a night. I know sometimes it gets very exciting. I like to answer a lot of these questions. How many milligrams of magnesium a day? 200 milligrams every 3 hours. How about cayenne pepper? Is it good? Cayenne pepper, think of it as a carrier, as a driver. So it is good if you're actually taking it with other supplements. So it does act as a driver to actually, because it is a blood stimulant. too much cayenne, it does fall in a nightshade family, so it could cause joint pain for some people. And as well, if you take too much cayenne, especially the proper heat units, it could cause hemorrhoids for some individuals. So you have to be careful of how much. Technically, if you are going to be taking cayenne, you need at least 90,000 heat units for it to actually work correctly. Anything less than that, you're just wasting your time and money. If you're using it for like specific things to actually heal the body. But if you're using it for food, 40,000 heat units is fine. That's it, guys. That was the last question I wanted to answer. You guys have a nice evening. We'll definitely catch up tomorrow again. I'll try to come in tomorrow 100%, and we'll continue our chat. In the meantime, you guys have a nice evening. Cheers.